Okay. So I've been a nurse for a long time. And one thing that I am always passionate and very concerned about is people's heart health. I think that we need to take care of our hearts in order for it to take care of us. If you don't take care of your heart, nothing else really matters. If you don't take care of your heart, it doesn't matter if you take care of your brain. You're not going to live long. If you don't take care of your heart, it doesn't matter that you take care of your outward appearance and sure that you're beautified and beautification, it won't last long. If you don't take care of your heart, um, it doesn't matter how well you exercise or how well um, you do the things that you do, whatever your profession is. It doesn't really matter. You can work hard, you can play hard, you can go do many different things, but if you don't take care of your heart, it's not going to matter. It's going to be a pointless whatever you try to do if you don't take care of your heart. Your heart is just that important. Okay. So I one of the things that I do, I talk to I'm a cardiology triage nurse, and every day, every single day, I talk to people. Sometimes it becomes frustrating, but um, I'm learning that I can't change people. I don't want to change people. I just want you to start thinking about what it is that you want. Okay. I wrote this down because I it just came to my mind and I think it's true, whether you think it's true or not. I said patients usually want help and they reject what is being given if it does not fit their motives. I said, that's an interesting thought. And then I looked up the definition of motives, and the definition of motives per Webster, it says, such as a need or desire that causes a person to act. I said, okay. So needs or desires that cause a person to act. Usually, when I get a phone call from a patient, it's because of a need or a desire or something is happening that's causing them to act. Okay. I'm a triage nurse, so I get the calls, the chest pain, the shortness of breath, my legs are swollen, I'm having this cough, I'm having this issue. So it's something that is bothering that person or something that has happened that is not usual to them that they want help with. Okay. And nothing wrong with that. Okay. A lot of times when I'm talking to people that have chest pain, I'm going to ask questions. Anybody that you talk to in the healthcare field who cares, and you call them and you say, I have a problem, they're trying to remember that they're trying to help you solve a problem. So, in order for them to do that, they got to ask the questions. Okay. They have to ask you questions, basic questions. They're going to ask you. They want to know about your medications. What medications are you taking? Have you taken your medications? You'd be surprised at how many times people tell me they haven't taken their medications, and it's the medications that they need. Okay. Um, are there any new medications? Have you changed any medications? If you go to a doctor and a doctor who's not your cardiologist changes your medicine, if your primary care changes your medicine, you should tell your cardiologist. If your dermatologist changes your medication, if your oncologist changes your medicine, if your pulmonologist changes your medicine, you should tell your cardiologist so that everybody's on the same page. You cannot assume that your cardiologist automatically knows that you're on a new medication. He may not know it until you call and tell him. Even if that cardiologist and pulmonologist and dermatologist are all in the same group or under the same insurance, doesn't mean that they know that you've changed your medicines because they don't know because you haven't said anything because they haven't seen you in 6 months or 3 months or 2 months or a year or 3 years. They haven't seen you. So they don't know. When's the last time you saw your doctor? When's the last time you came to see the cardiologist? If you only call cardiologists, again, motives, what's motivating you to call today? You're calling today because you have chest pain. I'm just giving these examples. You have chest pain, but you're not taking your medications as prescribed, or you're on a new medication from another doctor, but now you're calling the cardiologist because you have chest pain or something different is happening, or shortness of, but you don't go back to the doctor who prescribed the medicine expecting the cardiologist to do something about it. Let's be clear. If you started a new medication with a different doctor and the cardiologist never knew about it, it's hard for the cardiologist to make a determination when you've got some changes on your medication list and he doesn't know. You also need to include the doctor who's prescribing the medication just to help you. Okay. Um, so things that cause people to act: chest pain, shortness of breath, dizziness, leg swelling. If you have been taking a medication that gets rid of fluid, and the medication that you take, you have sudden weight gain and you have fluid all around your legs, you have fluid in your ankles, so the medication that you're taking isn't working, there are other things that are going on. Could be something going on with your kidneys. How much fluid volume, or how much fluid are you taking in? If you're taking in too much fluid faster than you can get rid of fluid, that could be a problem. And also, if your has your blood pressure been high for a very long time? You know, your kidneys and your heart talk to each other. They do everything they can to work together. And if you're not doing your part, okay, then that becomes a problem. Other things: what's your weight look like? That's something that's very sensitive with a lot of people, including myself. But if you're 200 pounds overweight and you are wondering why you have swelling in the legs, you could have blocked arteries, vessels, different things. If you have 200, if 200 pounds overweight, your heart is going to, it's going to be, it's more strain on your heart. The more weight you have, the more your heart has to pump. The more weight you have, the more collateral blood vessels you have. Collateral blood vessels are vessels that form simply because you're so big that it needs to make sure that it gets uh, oxygen and nutrient to every part of your body. So it had to make more veins in certain areas because of the amount of fat that you have on your body. It's a real thing. I didn't think of it. But so for every, let's just say every 7 pounds that you lose, that's about a mile more that you get back, that your body can circulate, the blood can flow. So you got to lose the weight. And you can't be mad at the doctor because you took your medicine for a month and you feel like you're not seeing a difference, but you didn't try anything to lose weight. You haven't tried anything any different. And I'm not getting on people that are overweight. I'm not. But what I am saying is you have to be a willing participant in your healthcare and understand that the doctors can only do but so much. You've got to do your part. Wouldn't you like to not be on medication? Wouldn't you like to not have to worry about going to the doctor every 3 months? Wouldn't you like to not feel like you have chest pain all the time? Wouldn't you like that your blood pressure is in a normal range? So you got to do your part. If you're overweight, your risk: hyper, heart disease, diabetes. If you're overweight, you your heart also is feeling the brunt of the weight that you have. I know people right now that are 300, 400 pounds, and then they're mad because they have chest pain and palpitations, and they're mad because they've changed 5 different blood pressure medications because none of them are working, but they're not doing anything else different. They're not exercising more. They're not taking in more water. Water is one of the best things for your heart. They're not taking in more water. They're not decreasing their fat content in their food. They're not making more home meals. And you don't have to be organic, but you can cook at home. You don't have to be a gourmet cook, but you can make a meal or two that doesn't involve high sodium, high fat. You could make, I'm just saying, you could make one dish meals, cut up some sausage, cut up some, or cut up some kielbasa. I'm just giving you ideas. Cut up some chicken, cut up some sauteed vegetables, put it over, some potatoes, rice, quinoa, or even with vegetables, sauteed meat and vegetables. You could do these things and you could probably, you're controlling the amount of seasoning and sodium that goes in that food. You're controlling the fat content that goes in that food. What are you cooking your food in? Are you cooking it in extra virgin olive oil? Are you cooking it in, lard? What are you doing? Are you using bacon grease? Are you eating more bacon and egg and cheese bagel sandwiches that you make? What is it that you're doing? You have to, if you've done the same thing for years and you see the same results, then that means you got to do something different. This is Heart Health Month. This is Love Month. This is also Heart Health Month. This is also African American History Month. So, in African American history, African Americans, are more likely to die from heart disease. I think it's 2 times more likely to die, according to the American Heart Association. 2 times more likely to die, 40% more likely to die than their white counterparts, simply because of, a lot of avoidable things like the foods that we're eating, like we got to decrease our stress, like we got to decrease that anxiety. You might need to cut some people off, get people out of your life that's causing you to, have feel some kind of way. You got to cut people off. You got to get rid of some things. You got to bring some resolve to problems, because your health matters. Trust me. I say it all the time. My mother worked hard. My mother was a wonderful person, but I did not know how bad her heart health was. I knew that she was born with an issue with her heart. I don't know if it's rheumatic heart fever, because she never really talked about it. She was in the bed until she was 16 years old, and then she got to go to school. She spent most of her life at they didn't have the King's Daughters Hospital in Virginia. They had Richmond Children's Hospital in Virginia when she was a kid. And so she spent a lot of time in the hospital. She spent a lot of time in bed. And when she was able to get out of bed, she didn't make excuses for herself. She didn't just lay around doing nothing. She got up, got her life together, graduated high school, and she went to work. She had her first kid at the age of 18. She had her second kid at the age of 20. Then she turned around and had a daughter at 25. That would be me. And never stopped working, never looked back, never made excuses. Working 3 jobs at times, but doing the best that she could for her family. But she neglected her heart. She neglected taking care of herself. She neglected taking care of her medication like she should. She neglected the advice of the doctor. Even when she went to the doctor, I'll never forget the guy, because she'll never forget him. My mother has passed, and I don't even know if her doctor is alive. But his name was Dr. Ansari. Dr. Ansari, and he met her when she had her first heart attack, and he took care of her ever since. But she hated him in the beginning. She couldn't stand that doctor. She would talk about him in a negative way. How dare he talk to me when I walked into his office like that? How dare he say those things to me? But it was the things that he said that made a difference. It was the things that he said that caused her to get sodium out of her diet. It was the things that he said that caused her to monitor her blood sugars. It was the things that he said that made her make life-altering changes. And she did for a very long while. But one of the things that she didn't get rid of was stress. And that would probably be when she had her second heart attack. And things just kind of took a turn for my mother. But I say all that to say it doesn't have to be your portion. That doesn't have to be your story. Your story starts today. Your story can turn out much different. There's nothing but once you make a decision, make a choice, change your motives for what you want and why you want what you want concerning your health. You change those motives, your whole life will change. When you change your motives, you're not calling the doctor because you got chest pain. You're calling the doctor because you've now lost 30 pounds and you want to know, can you change your meds? You're calling the doctor not because you have shortness of breath, but you're calling the doctor because uh, you have you want to go out of town, you want to go skydiving, and you want to make sure that everything's okay. You're exercising, and you just want to make sure that you get your next physical to make sure that everything's okay. See the difference? The difference is your motives. Okay, so that's all I wanted to say today. I just want you to think about it. I want you to do something. I want you to always remember that if you take care of your heart will surely take care of you. Have the best day ever. Bye-bye.